Hello, everyone. How is everyone doing today? We are live with Dr. Marian, and at least on Facebook. I'm waiting for her to come on to Instagram as well. And so I think she's about to join us. Hello, Dr. Marian. Can you hear me? Yeah, can you hear me?
Not yet? Hello.
Okay, perfect.
Hi.
Well, it's good to see you. It's good to see everybody, at least their names joining up here. So it is a kind of a funny thing, isn't it, Dr. Marian?
Yeah.
Talking to ourselves and just seeing these names pop up and making little comments. It's an awesome thing, but it's quite a challenge sometimes to just talk to yourself on this thing. I'm glad that I'm doing it with you today.
Me too. I'm enjoying these.
Yes. So we're talking about food for breast health and for cancer prevention. And we're doing this since this is Breast Cancer Awareness Month, and we are...
there you go.
Is that better?
Yeah.
Yeah, you can see me a little bit better.
Yeah.
We are providing these live educational services as a form of service from Holistic Medical Center here in Bellevue. So welcome, everybody. Please join us with your questions and comments. We love to talk and chat. And, you know, most of you that have seen us in person know that we love to talk. But we want to make this more relevant to what your questions and thoughts are. So breast cancer and food, breast health and food. What are your thoughts, Dr. Marian? Why don't you start us off?
Sure. So, today we're going to be talking about foods that may either improve your risk for breast cancer or worsen your risk for breast cancer. And ultimately, this is a talk about hormone balance. So even if you are not aware or not concerned about breast cancer risk, we really are discussing balancing female hormones. So this is going to apply to any type of menstrual complaint like PMS, endometriosis, all types of women's health conditions can be affected by essentially unopposed estrogen, which we're often talking about in terms of breast cancer risk. So all of the foods and the dietary sort of strategies that we're going to be talking about today can also be really supportive in just balancing women's health in general. So we're going to be talking about a number of things, including soy and the big controversy around that. I know that there's some confusion from a lot of people about, is soy good, is soy bad? We're going to be talking about particular foods that improve estrogen metabolism, both by way of supporting liver function as well as by improving the ratio of estrogen metabolites. And we're also going to be talking about some unique aspects of some other foods that that prevent cancer in unique ways. So we'll get into lots of that today.
Great. So one of my first questions is this popular concept: do we do keto or do we do vegan diet, plant-based diet for breast health and cancer? What are your thoughts on that, Doc?
You know, I don't really subscribe to one diet fits all. I think that dietary choices and strategies are really person dependent. And so for some people, at least for a temporary time, keto might be the best approach for them. Other people are going to do better on a vegetarian diet, other people paleo, Whole30, autoimmune paleo, that kind of thing. So you really have to find what works for you and what you feel best on. Of course, when there does happen to be cancer or something along those lines as far as health conditions that enter into your life, sometimes we have to make drastic changes. And so in those cases, I do see keto or a keto-based diet being supportive. We talked about that a lot last week as far as the metabolic theory of cancer, in terms of cancer requires about 200 or uses about 200 times the amount of glucose that any healthy cell does. And so by having elevated blood glucose by any means in your blood is going to promote more cancer growth. So the keto approach can be beneficial when there is something drastic like that cancer that happens and you need a big shift. But in general, at least for women, it can negatively affect hormones in the long term if someone's doing long-term keto diet.
I completely agree with you. So personalized medicine, personalized food and personalized nutrition is really important. But in general, just the research has been showing that a plant-based diet, again, is more beneficial than a keto-based diet for women, and especially postmenopausally. So, and I find that personally that more of a vegetarian, plant-based, like using beans and lentils and tempeh and nuts and seeds and whole grains, is powerful with hormone balancing and reducing cancer risk because of the hormones that we typically find in animal products. Cow dairy, cow milk, cheese, and then meats as well. And so when you're exposed to those animal products, that, by the way, cows are producing milk, so they're going to have more hormones running around. And if you're postmenopausal and you're eating foods that have more hormones in them, then you're going to be throwing off a lot of the estrogen progesterone balance in the system, plus the fact that we talked about earlier in the earlier lives that estrone, one of the more toxic estrogens, is made more from the fat tissue, especially postmenopausally. And that's why we see postmenopausal breast cancer more commonly than we do in the under the 50. Although under the 50 cancers, or under the menopause, premenopause cancers are becoming much, much more common lately due to many other reasons as well that we've mentioned in the past. So all in all, I believe that the research is pointing towards more of a plant-based for postmenopausal, and I think premenopausal is a very different story because you have different hormones working for you, so you may be able to tolerate like a keto diet better, or a little bit of a paleo. But keep in mind that the research is showing that meats will increase estrogen dominance. So, Dr. Marian, would you like to talk a little bit about estrogen dominance, foods and things like that?
Absolutely. So estrogen dominance is a term that we use when we are referring to an imbalance between estrogen and progesterone primarily. And it's not necessarily the amount of estrogen, though that can be involved, but it's actually the ratio between estrogen and progesterone that's important. And so if you have a very high ratio, a tipped scale towards estrogen and a lower level of progesterone, that ratio is going to lead to a lot of problems in the body and a lot of estrogen related conditions, including breast cancer, among others. But estrogen dominance is caused by a number of things, including obesity, diabetes, genetics, high fat, high sugar, low fiber diet, toxicity, dysbiosis, so an imbalance between good and bad bacteria in the gut, chronic stress, as well as birth control. So we're talking about foods today, so we'll focus on that. But in terms of switching the balance towards more balanced estrogen to progesterone ratio, we want to remove some of the factors that can contribute. So those include smoking, alcohol, birth control, and poor diet. So we're cleaning up the diet. But then we can talk about particular foods that improve the estrogen metabolism. And so therefore, again, the scale more towards balance. And so when we're discussing improving estrogen metabolites, we can think of cruciferous vegetables like broccoli, cabbage, cauliflower, kale, bok choy. I think bok choy is a cruciferous vegetable. That's on my list. And one of the active compounds in those vegetables is something called indole-3 carbinol and diindole-methionine. And both of those are derived from cruciferous vegetables. And we can use them as a nutritional supplement as well to help improve the estrogen metabolism, the ratio of the 2:16 estrogen metabolites, so towards a less toxic metabolism route. We can also use flax seeds and soy isoflavones, so something called genistein and diadzine, which are two compounds of soy. And we also use fish oil, so improving the omega fatty acid content of the diet can be really helpful. So olive oil, really healthy fatty fish like salmon, wild caught only, not farm farm raised. And then reducing dietary fat and increasing dietary fiber can help, because the fiber is important in improving the microbiome, so the good bacteria in the gut, and that's going to be helping to get estrogen out of the body. And then rosemary, kudzu, which is I believe Japanese food, and turmeric can also help improve the 2:16 ratio of estrogen metabolism. That's a number of foods right there.
There's a lot of foods. Good job.
So if you got your pen out.
Yeah, I know. We need to run through that again or listen to this a few times, right? So one of the things that I think most commonly we find most people eating is cheese and dairy products. I personally grew up on a glass of milk as a kid, and I had leg pains and body aches throughout my childhood and teenage years, sinus congestion, and I didn't really know why that was happening until I got into school, Bastyr, and then discovered that, hey, food can be a big source of inflammation. So if you think about most people, when they have a glass of milk, they get mucousy, right? Mm-hmm. Clearing their throat, or maybe even as much as getting sinus congestion. So if you think about that, how much mucus production is induced by drinking a glass of milk, you then can relate and understand that the lymphatic system can get bogged down with dairy products, with milk. And so when you're eating a lot of cheese or cow's milk products, they can have an impact on blocking the lymphatic flow. And we talked a lot about the lymphatic flow in the last few sessions, and that the breast tissue is really a lot of lymphatic tissue. And so if you're blocking up the lymphatic system through food, then you're going to increase your risk for breast cancer, along with fibrocystic breast disease and a few other breast conditions, PMS, breast pain with premenstrually. And like Dr. Marian was saying, the dairy can also increase the estrogen to the progesterone ratio, right? Mm-hmm. So by the way, hello, Instagram. Love seeing all of you out there, and hello, Facebook. What's interesting about dairy is that there's 25 different types of protein in dairy, and 82% of these proteins in dairy are what's called casein protein, different types of casein protein. And majority of the casein protein are problematic. There is the alpha casein protein, which some of the studies have shown that it can actually be really beneficial for preventing or reducing breast cancer specifically, but majority of the casein is problematic. So what the studies have also been looking at is, or identified, is that there is a dose relationship between cancer risk and the amount of dairy that you're intaking. So for instance, there was a study that was just released in 2020, February of this year, looking at 53,000 females. And what they found was that about a quarter cup to a third of a cup of milk per day was associated with a 30% increase in breast cancer, whereas if you were drinking a whole cup of milk every day, that went up to 50% as well, increasing your risk for 50% of the time for getting breast cancer. And then 2 to 3 cups of milk a day was like an increased risk of 70 to 80% of breast cancer. So they're seeing this linear relationship between how much dairy you actually take in and how much risk factors you may have for breast cancer. What's also interesting, though, is that when you start culturing milk, so kefir, yogurt, it changes the composition and the risk factors actually reduce. So eating yogurt is not going to increase your risk for breast cancer as much as drinking a glass of milk. And there's a lot of comments coming through on Instagram, at least, which is wonderful. Thank you for talking about movement and walking and all of that to get the lymphatic system moving, definitely. So in terms of food, dairy is in my books, is a no-no. I'd rather do no dairy and do almond milk or oat milk or one of the other plant-based milks. In fact, they showed that using even soy milk, which is not one of my favorites, using soy milk instead of dairy, that also significantly reduced your breast cancer risk based on just comparing soy milk versus dairy milk in cancer patients. And then there is this question about what about probiotics in the yogurt? Well, that is one of the reasons why fermented dairy products are beneficial and reduce the risk. At least we suspect that that's one of the reasons, is because of the probiotics in the yogurt, in the kefir, which help balance not only hormones through providing the good bacteria in the gut, but also provides better immune function and decrease the inflammation. Mm-hmm. So one other thing, Dr. Marian, I want to say about milk is that the whey protein found in camel milk. So,
yes.
Yes, camel milk, there's camel milk, there's donkey milk, right? There's goat milk, but the one that they have found to be most effective in having anti-cancer properties is camel milk. Yeah. Right. So those Egyptians, the Middle Easterners are doing great having access to their camels and drinking their milk. I know when
pretty expensive.
Yes, but it's
I looked into it.
Yes, it's potent though, right?
Like $200 a bottle, but yeah, it's very potent. It's incredibly immune stimulating. It's actually been shown to be pretty effective at managing certain viruses.
Yes, it's an awesome milk. Now, donkey milk is another one. So when I was in Greece a few years ago, I learned about donkey milk. Wow. And, there's donkey milk soap. You can actually get it on Amazon. It's fantastic for the skin, especially if you have acne. It's a great cleanser, and it provides you with the good fats for the skin, keeps the skin really nice and healthy. If you've got eczema or any kind of sensitivity, allergies, skin allergies, that donkey milk soap is beneficial. In fact, they use donkey milk in Greece when the babies have allergies to cow's milk. That's the milk they go to because it's very, very healing. Yeah. But there was a study in 2018 that showed that donkey milk actually suppresses triple negative breast cancer progression. Oh, wow. So triple negative breast cancer, for some of you that may not know, is the most aggressive of all breast cancers. It's found like in 1 to 3% of the population of women that do get breast cancer, but it's triple negative, which means that it's estrogen receptor negative, progesterone receptor negative, and HER2 negative. And so it makes it a lot more aggressive to progress and metastase and increase metastasis in the body. But donkey milk is helpful in reducing that.
It's also very difficult to treat because it lacks those receptors. So a lot of the conventional medical treatments for breast cancer involve targeting those receptors. And if that cancer doesn't have any of the three, it makes it more difficult for those drugs to work, basically. So it's a very or less treatable cancer.
Yes. One of our patients, one of our clients that's sending a message, the princess takes baths in ancient times in donkey milk. She is, I believe, actually from the Middle Eastern area that she's texting us and listening to this live. So she knows that donkey milk is really good.
So yeah, oopsies, I lost my headphone. On the topic though of dairy, I think there is some controversy around soy. So if we could just take a minute to talk about that really quickly.
Sure, do it, please.
There's 2 isoflavone compounds, which are just chemical compounds that are part of soy, and those are genistein and diazine. And I don't know if I'm pronouncing those correctly, but these are known as phytoestrogens. And so they act like estrogen in the body. And so there's been a long history of science and the medical community trying to figure out whether that's a good thing or a bad thing. And you might have heard mixed sort of reports of whether soy is good for you, soy is bad for you, soy causes cancer, soy prevents cancer. There's a lot of confusion, but in general, a higher intake of dietary soy is actually associated with a lower risk of breast cancer. And there was no increase in mortality with intake of soy once diagnosed with breast cancer. So studies in general have seemed to sort of contradict each other, but in summary, and they actually do depend a lot on how the studies were carried out, what type of soy they used, when they were giving it, etc. But the bottom line is that soy has either a beneficial or no effect at all, but not a negative effect on women's health and on breast cancer risk. So the problem actually with soy is that it is highly genetically modified. So the true flaw of soy, I would say, is actually modern engineering of genetically modified soy that is highly pesticide rich. So there's a lot of glyphosate or Roundup and other types of pesticides on there, and that can make it very toxic. So if you are going to be eating soy, I would say the best is organic and fermented, but 100% never ever buy non-organic soy. And the same goes for corn, because corn's also highly, highly genetically modified. So that's going to be a biggest, or one of the major parts of the actual problem of soy, which is that there's xenoestrogens, which is bad artificial or chemical compounds that act as estrogens in the body. So phytoestrogens good, xenoestrogens bad. Bottom line.
Bottom line, thank you. Yes, and on the genistein also, I came across this study that looked at genistein, which you mentioned earlier, than one of the components of soy, as possibly a promising chemopreventative drug for drug-resistant cancer patients. So if you have a breast cancer patient who is not responding to chemotherapy, they're doing some studies looking at genistein as possibly helping improve that chemosensitivity in those patients. So that's very, very exciting.
Yeah, interesting.
Yeah, it's very, very interesting. Pomegranate.
Yeah, I love it too. It's almost that season.
It is that season. Pomegranate is a Persian fruit. It came from Persia, and I'm Persian, so that's why I love pomegranate so much. But there's a number of studies about pomegranate and pomegranate seed oil and pomegranate juice and pomegranate seeds and the impacts it has on inducing cancer cell death. And one study looked at pomegranate seed oil and found that there was a 75 to 90% breast cancer death. Another one showed 50%, 54%. And then they looked at pomegranate fermented juice to be really beneficial as well. So there's a lot of studies coming out about pomegranate because it is pretty high in antioxidants. It has a lot of bioflavonoids. It has a lot of vitamin C and vitamin E, a number of minerals. And it seems to be really promising for breast cancer prevention and inhibition of cancer cell growth, as well as possibly adjunctive therapies as an adjunctive therapy with breast cancer. Okay, now we're getting my husband, John, talking about apricot seeds. Apricot seeds, B17. Well, the unfortunate thing is that apricot seeds and B17 is kind of an illegal substance in the US. And so unfortunately, we're not allowed to use it in the United States. The Mexicans, South Americans, the Canadians, the Europeans use B17 quite a bit with their patients, and patients use it. So in Middle East too as well. You can't say that, John.
For anybody that's watching the video later, John just mentioned, because we have so much at our house, referring to the apricot seeds.
Actually, that was a gift from my cousin. Got it from Middle East when her husband went to visit his family. And at that time, she was fighting breast cancer. So she brought back some for herself in Canada and dropped by some for us. So apricot seeds, if you can get it, it's awesome stuff. But we won't talk about that.
stock up on apricot seeds.
Yeah, stack up on
Over the
apricot
Darvish's
seeds,
house.
What else, Dr. Marian?
Okay,
Anything else to
so
enlighten us with?
we're having a lot of fun today. I love it.
Lots of laughter.
So I want to just talk about some of general ideas to reduce estrogens, because there are some really amazing foods and we want to definitely include those. But in general, we want to think about a whole foods diet because of the added amount of fiber. Again, that's supporting the microbiome. It's also helping to bind up estrogen in the gut and get it out of the body so that you don't have too much estrogen, which leads to growth and cancer. You want to support liver function, so liver supportive foods are things like artichoke, beets, lemon, especially doing hot lemon water before a meal can be really cleansing and supportive to the liver. Basically, anti-inflammatory whole foods diet is kind of the general idea, and increasing essential fatty acids. You want to make sure that you're pooping every day too, just as an aside. To make sure that, again, it's moving through the food that you are eating is moving through the gut in a timely manner so that you don't have time to reabsorb those estrogens as well as other toxins. So yeah, did you want me to go on?
Yeah. I just wanted to jump in and answer this question from Farah. Hi, Farah, by the way, nice seeing you. And she asked, how do you eat those apricot seeds? And they're just like almonds. So you just eat them like almonds. They actually look and feel like almonds, but you don't want to eat too many of them, maybe 3 to 5 of them a day. More than that is actually toxic. So you don't want to eat any apricots. Don't eat them like a handful of almonds too much, okay?
Yeah.
Yeah, go on, doctor.
Oh, well, and then I just wanted to talk about organic food. Again, I know I've mentioned a couple times already today the pesticides, but it's a big issue, and a lot of the cancers that we're seeing in more modern times, the rates are really increasing, and that's largely a factor of our environment and our diet, the standard American diet. And I think a big part of that is the sort of the agricultural world shifting towards more and more pesticides. So glyphosate is a very bad toxin that can cause a lot of harm in the body and can contribute certainly to breast cancer as well as other cancers. So making sure that if you can buy 100% organic, then that is ideal. If finances are not supportive of that, then take a look at the environmental working groups, Clean 15 and Dirty Dozen list. The Clean 15 produce are foods that you can buy non-organic pretty safely. Those have been tested this year to show the least amount of pesticides. The Dirty Dozen are foods that you produce that you never want to eat non-organic, because those have the highest levels of pesticides when you buy them non-organic. So keep those ideas in mind.
So there's a couple of questions. Actually, let me see if I can find this. What about drinking lemon water not warm throughout the day?
Yeah, great.
Lemon water is great because it is alkalinizing and it's a cleanser, which is great. But again, keeping the fiber in the diet is also going to be really important to pull those toxins that get released from the lemon water.
Yeah,
keep the liver out, right?
I love it warm before a meal just because it does help to start your digestive process. You're going to start making hydrochloric acid in the stomach. You're going to start making digestive enzymes. You're going to get the liver and gallbladder pumping bile into the intestine. So kind of jump starts your digestion, which is therefore supportive to the liver. But by all means, all day, if you like lemon water, then absolutely.
Yeah, it's a great cleanser. There's that cleanser called the Master Cleanse, which is, I don't know if it's as well known now as it used to be when I was growing up. It was the Master Cleanse, which was lemon and maple syrup, a pinch of cayenne, and water. And you basically did anywhere between 3 to 40 days of this Master Cleanse to cleanse the body and alkalinize the body. So there's a whole book on the Master Cleanse if anybody wants to read about it. It's great. It's just it's a great cleanse for some people. It doesn't work for everybody, but it's great for some people. Just going back to the whole concept of individualized medicine, right? Nutrition is individualized. So not everybody is going to do well with all of these different types of therapies. There's another question, Dr. Marian, I think we might want to answer this, is what if we don't have much organic food where we live?
Yeah, that's tough. So basically in an organic food desert, which is a pretty big problem, that's also commonly areas where you're right next to agricultural areas. So you're right next to a farm, but you can't get organic food. The problem with that is that you're also getting probably sprayed by a lot of the pesticides that are going on those farms. And so people that are living out in sort of rural areas with no access to organic food are not only eating glyphosate and other pesticides, they're also getting sprayed on them, on their houses, and so they're breathing it all the time. And I don't have a great solution. I mean, definitely look at the Clean 15 and Dirty Dozen list from the Environmental Working Group, and really probably avoid the Dirty Dozen produce if you can't get them organic, and then possibly looking into some sort of CSA. I don't know what that stands for, but when a farmer, you kind of contract with a farm to drop off a box of produce once or twice a month or even more, because I think that does reach out to areas where you might not find organic stores, but you can potentially get those things shipped to you. And so it's a really important thing to look at. So I would definitely strategize a bit around it.
Yeah, Farah also reminds us to clean the veggies with some vitamin C crystals, wash them really well. I like the veggie wash from Trader Joe's.
Mm-hmm. Yeah.
And it's got grapeseed extract in it. It's a quick, nice rinse to kind of rinse as much of it as possible off the fruit and vegetables. The problem is that these chemicals are engraved into the cells.
Yeah.
You can't get it all, but at least, if you're eating an apple, you can kind of peel it or wash it. If you are eating plants or vegetables or fruit that are peelable, peel them if they're not organic. So bananas, avocados, a lot easier to tolerate when you are peeling them away. So any other comments?
Oh, just that somebody mentioned that CSA stands for Community Supported Agricultural farmers. So that's cool.
Yes.
Yeah.
Yes. Any other comments, Dr. Marian? Any other thoughts? Because I know we're kind of coming up to that 40-minute block.
Yeah. Well, I would say this topic is pretty huge, and so rather than trying to navigate the sort of mess of information that's on the internet, working with a naturopathic doctor who has had a lot of nutritional education is really important. Whereas conventional doctors really only have, I think, between 2 and 10 hours sometimes in their programs of nutrition. Naturopathic doctors are really well versed in all of the ins and outs of food as medicine. So really working with somebody that has your best interest in mind and that knowledge to help to prevent breast cancer, as well as if you are diagnosed, to help to optimize your outcome.
Yes, great. Thank you. I do want to mention one thing that I don't think we emphasized enough is the fact that cancer feeds off of sugar. So absolutely no sugar in the diet is really important. You can do keto, you can do this diet, that diet, but get the sugar and the alcohol and the fruit juice and the sodas out of your diet, because you're just promoting more cancer growth, food for cancers to grow.
That reminded me, one last thing. A lot of people are like, oh, cancer doesn't affect me, I don't really have to think about this. But actually, only 1 in about 1,000 healthy adults has no cancer cells in their body. So at any moment in time, you have between 500 and 1,000 cancerous cells floating around your body. And then your immune system is able to tackle those and keep it from turning into actual mass or cancer. So think about that when we're making these dietary recommendations, because again, we're all walking around with cancer. We don't want it to turn into a tumor or whatever type of cancer. So prevention is the best medicine.
Yes, absolutely. There's a couple more questions that I just want to get to before we end. One is, what about 10 drops of grapefruit seed extract to rinse your veggies? And yes, that's great. And pomegranate syrup. What about the sugar in pomegranate syrup? So you don't want to do pomegranate syrup. You want to do either the seeds or the seed oil. So you don't want to necessarily do the syrup. And if you're going to do the juice, you want to do the pomegranate fermented juice. So you're not getting the sugar as much. When you ferment fermentation utilizes the sugar in that product. So you're reducing the sugar and increasing the probiotics in that food, which is what we want. Cookbooks, websites, any thoughts on those?
Oh, well, I'm reading right now Nasha Winter's The Metabolic Approach to Cancer. It's a wonderful book. I don't trust the internet.
I don't either, but there is a few books out there specifically for cancer. And Nasha Winters is one of the good books, Metabolic Diet, right, for cancer. So, but again, what you read is not necessarily what's going to be good for you personally. You really should see a provider to kind of home in to what your body needs specifically to help fight off cancer or prevent cancer. Again, please remember that none of these lives are intended to make any claims about cures or treatments. We're just providing information, and it's best that you do seek your own provider for more specifics. Next week, we are talking about supportive cancer therapies, and it's an important one because we're going to be talking about therapies that you may not hear anywhere else. And please join us. Let your friends know to join in either on Facebook on Holistic Medicine or on our Instagram here. And we will be happy to entertain any comments and questions and share with you what we know. So thank you again for joining us. We will see you next week. Take care. Bye-bye. Thank you, Dr. Marian.
Thank you.